Hello, good afternoon. I am Dr. Christina Wells, and welcome to our program on gut health, the second brain. We are so excited that you are joining us this afternoon. And for those who will watch this rebroadcast, you are in store for an awesome program today. On behalf of the Lake Region Conference of Seventh-day Adventists, I want to welcome you to this very informative program. On behalf of our president, Elder Garth Gabriel, and our administrative team, we are so happy that you were able to join us today. I'm going to talk to you about our speaker and presenter for today. This is just a phenomenal physician. Dr. Janese Laster is quadruple, and that's what I said, quadruple board certified in internal medicine, gastroenterology, obesity medicine, and a nutrition physician specialist. She completed both residency and fellowship training at Georgetown University Hospital, then the Nestle Clinical Nutrition Fellowship, and an advanced bariatric endoscopy fellowship in Madrid, Spain. She then founded Gut Theory Total Digestive Care, where she specializes in uncovering the root causes, the root causes of excessive weight, customized weight management through evidence-based nutrition, anti-obesity pharmacology, and innovative, non-invasive bariatric endoscopic weight loss procedures. She has a wealth of knowledge that I'm so excited that she is going to share with us today. And so get ready, get your notebooks, take some notes. We know that the gut is so very important to our overall health and it is the originator of a lot of diseases that we see, as she will present to us today. So take notes, and please don't forget to drop your questions in the chat if you have any questions for Dr. Laster. And again, thank you for joining us today. We're going to have a word of prayer, and then we're going to start with Dr. Laster and her presentation. Let us pray. Dear Heavenly Father, Lord God, thank you for bringing us here today. Thank you for the information that will be shared. Help us to learn how to take care of our bodies and be in good health. In Jesus' name we pray. Amen. Well, without further ado, we're going to have Dr. Laster join us. Good afternoon, Dr. Laster. How are you?
Good afternoon. I'm great. Thank you so much for having me. I'm so happy to be here.
I'm so excited to have you here. As I said before, it's so wonderful to see all the accomplishments that you've had. And we're so excited that you're going to share with us such a very important topic today. So I'm going to go ahead and I'm going to sit in the background and allow you to take over. So thank you again and welcome.
Thank you. Thank you. And is my screen sharing now? Yes, it is. All right. Thank you guys so much for having me. I'm so excited to be here today. And we are going to jump right in and talk about common gut diseases and sort of how to build a healthy microbiome and what that even means. So we'll start a little bit about what is gastroenterology? What is this crazy field that I'm in, and the GI tract? A little bit about gut health, so what it is and what it isn't, the microbiome, pre and postbiotics, which are sort of a big topic right now, and then diet and nutrition a little bit more. So let's pop right in. We're going to talk about sort of the nerdy words with some of these things, but then talk about what they mean in sort of for your everyday life. So some people may say, what is a gastroenterologist? So we are physicians that look at your GI tract. And what are your gastrointestinal organs? They are your esophagus, your stomach, your small intestine, your colon, your rectum, but also includes your pancreas, your gallbladder, your bile duct, and your liver. And we'll talk about those in far more detail. But your GI tract includes all the material that we ingest through our mouth that goes all the way through your stomach, your small bowel, and eliminated through your colon, right? So that is sort of your GI tract. And things outside of your GI tract, like your pancreas, your gallbladder, your bile ducts, those are things that also empty things into your GI tract as well. And this is sort of a look of what that would look like coming from your mouth and eliminating through your anus. So thinking about it as if it is a one-way tract in and out, which is why it's so important to think about what we consume every day as well, correct? So let's start from the top. I want to talk a little bit about what type of symptoms that a lot of my patients may have and they think are no big deal and they may ignore for a little bit of time. So I want to think about what those diseases are. And later on, we'll talk about how to sort of make sure you don't have these diseases, but also when you need to be seen by a gastroenterologist. So, starting from the top in the esophagus, people may have symptoms of what's called GERD, heartburn, or commonly reflux. And what happens then is you have burning in the esophagus. You may feel a sour taste in your mouth. You may even feel chest pain. Some people may feel the need to go to the emergency room. Some people may feel some discomfort in the middle of their chest. Some people may feel a sensation of feeling full quickly. So a lot of common things that people can feel with these symptoms. Some people may have cough from the acid in their esophagus as well. So all sort of common symptoms. However, people may ignore some of those things and not think really a lot about it. Um, and this could be due to several different things. It could be due to diet, of course. It could be due to the size of meals we're eating. It could be due to the time of night in which you start eating and then lay down. It could be due to alcohol. Could be due to excess weight. Could be due to medications or pregnancy, or maybe there's something anatomical inside, like a hernia that pushes up on your esophagus and stomach. These are all very common things. People think not a big deal. However, the common things that happen in some of our patients from chronic reflux or heartburn is you can get what's called narrowing of the esophagus, where that scarring of that acid over time can cause significant narrowing and cause people to have difficulty swallowing. And so it's something that people don't really think very much about. Another thing can happen is silently, if you have so much acid on the bottom of your esophagus, that also can cause changes in the bottom of your esophagus, which can be cancerous changes, something called Barrett's esophagus. So these are things that are all really important and why you should follow with your gastroenterologist. There's also bacterial infections that can be seen in the stomach called H. pylori that can cause people to have increased symptoms of heartburn as well. So if these are symptoms that if you notice they're happening persistently, they're getting worse, they're not being helped by over-the-counter things, which should only be used for a brief period of time, we want to see you in the office. Next up, moving from the esophagus down to the stomach. So people can have a variety of different types of abdominal pain. Some people have pain after eating. Some people have pain after bowel movements. They may have pain if they eat too much. Some people can have pain sort of in certain areas in the middle of your stomach, the right upper side, the left upper side, left lower quadrant, right lower quadrant, pain that moves to the back. There's many different types of abdominal pain. And I don't want people to think about them and just say, no big deal, right? Oh, it's just gas. Oh, it's just, something I ate. If somebody has persistent pain, that's something that should be followed up with your physician. And this is a list of things on this left-hand side that sometimes people don't think about. They see heart attack over there. You see fancy words like cholangitis. And what does that mean? That means that you have a gallstone that can come out and get stuck in that gallbladder duct and cause people to have pretty significant disease that require them to be in the hospital, require procedures. And so it can range from something as benign as gas to something as big as a heart attack, right? Or appendicitis, or having pancreatitis or gallbladder disease. So really sort of something that we want to make sure that you don't take lightly. We want to make sure you're following up and you're being seen by a physician. Other things that can happen are some things like nausea and vomiting. Also things that people may ignore, but that should not be something that has happened persistently. You should not have this every single day. Many, many reasons for nausea and vomiting, sometimes from heartburn, so excessive acid, something we've already talked about. Sometimes it can be due to medications you may be taking, commonly for food or diet, but also it could be anatomic problems. It could be cancer. It could be from constipation. It could be something called gastroparesis, where your GI tract is also slowed. So these are things that we also want to, again, take note of, take seriously, and have to make sure you kind of take note of when it's occurring, if it's occurring at particular times of the day, the morning or the evening before you go to bed at night, or after you have certain foods. Other things that can happen in the GI tract are bloating. It's a really common symptom that we see quite often in our GI clinic. This can be something, again, that could be benign, could be gas related to some food that you've eaten, or it could be to things like having a lot of carbonated beverages or smoking or diet or constipation. But we also want to make sure it's not something like inflammatory bowel disease with a stricture, and that's Crohn's, or where you can have issues in your small intestines. So again, something that people may think is benign, but should also be seen by a physician if it's something that you see very, very frequently. Moving through the GI tract, now we have the gallbladder. The gallbladder is, creates gallstones. It secretes sort of things to help us with digestion of food into your GI tract. And sometimes people can get gallbladder disease if they have diabetes. If you have excessive weight gain as we get older, particular medications, elevated cholesterol. And these are all things we sort of think about. And sometimes if people have pain that's in the right upper quadrant, that can, or they feel it sort of right after they have a really big, sort of spicy or fatty meal, that may be a sign that there is a gallstones that are coming out of the gallbladder, getting stuck in that duct that you see there, what's called that common bowel duct. And that's sort of a sign that causes people to have pain. It could cause really big, important things like pancreatitis, or it can cause even more important things like a really big bacterial infection called sepsis that requires you to go to the hospital. So things we want people to think, pay more attention to their bodies about. And then moving from the gallbladder to the liver. The liver is really important, something we'll talk a lot about, because everybody has heard of cirrhosis. When people hear cirrhosis, they automatically think, oh, alcohol. And yes, alcohol is something that can cause cirrhosis, but there are other things that are becoming far more prevalent in our population, which is fatty liver disease. Fatty liver disease is what you see right here in the middle. And it's really when we have excess food in our diet, and sort of our body doesn't really know what to do with it. And it just dumps it off in the liver and says, you know what, I'll come back and pick it up later. But what happens if we continue on that diet, which is sort of a standard American diet, that continues. And over time, what happens is that fatty liver can progress to fibrosis, which is scarring of the liver. And then again, that tissue can be replaced with scarring, which is now permanent. And this is sort of what's called cirrhosis. And that's when it's end stage and irreversible. At the fibrosis stage and fatty liver stage, it's completely reversible with dietary changes. And that's really sort of what we have in place when patients come to see us in clinic. Sometimes they get referred to us if their liver tests that your primary doctor may obtain are a little bit elevated. And then they'll ask you about alcohol and medications and those sorts of things. They'll test you for hepatitis B, hepatitis C. And if all those things are negative, then they send you to a gastroenterologist, and we would sort of do certain types of scans to see how much fat is in the liver, and then start to talk about your diet. And really is about 5% of a total body weight loss can get patients sort of to reverse back to that healthy liver, because we don't want our patients progressing to cirrhosis, because the only treatment that for reversal of cirrhosis is a liver transplant. And we know there are not enough livers to go around. So we want to prevent people from getting there. And that's actually, believe it or not, one of the number one causes of liver transplants in this country now. It used to be hepatitis C. Now we can treat that. Now it is becoming fatty liver. So that's one of the things we want to be able to reverse with our patients, with showing them how to eat and catching it early. And then we think of the pancreas, pancreatitis. That's also sort of a big deal that we think about as well. Pancreatitis can come from alcohol, can come from smoking, can be something that's hereditary or autoimmune. It can come from those gallstones we talked about. It can come from having persistently high blood sugars, or having really high triglycerides, or one of your cholesterol numbers. And that causes your pancreas to get really inflamed. You can have pain in the middle of your stomach here, and that can move to your back. That's something we also don't want you to ignore. We want you to come to the hospital and get treated. And pancreatitis is also a big deal. Now, move into your colon and what can happen there. So some patients may have range from constipation to diarrhea. And it's another thing that's commonly ignored, right? It's what type of poop should we be having? GI doctors, we talk about stools all the time, and so we don't get freaked out by it. But a lot of patients don't really want to talk about it. Not something they really want to come and talk to their physician about. Or some patients don't even look at their stools. But looking at your stool is really important. And if you look at this Bristol chart we have here on the left, we're looking at what normal stool sort of looks like. And so type 1 patients don't recognize this, but it's a really hard stool when they're coming out like little pebbles. It takes a long time to push things out. That's constipation. Although you're having stool that's coming out, it's still constipation. Type 2 is sort of when it's still sort of lumpy, and the goals for getting people to like type 3 or type 4 in their stools, right? So nice soft stools, you don't have to strain. They come out nicely. You feel like you're completely empty when you go. You're not having to strain. But we also don't want people to have a lot of diarrhea either. We want to think about some of the reasons that people can have diarrhea. And so we talk a lot about constipation because constipation is another one of those reasons why people can have bloating, nausea, vomiting, or abdominal pain. So it's a really common cause of all of those things. Why do so many patients have constipation? Most of it is diet. So a lot of patients don't have enough water. They don't have enough fiber in their diets. Most people don't have enough fiber, and they have a lot of meat in their diets. So these are things that all can contribute to having constipation. But as GI doctors, we're also thinking about things like if there's any strictures or narrowing in your small bowel or in your colon as a reason for you to be having that as well. So we're thinking about all of these things for something as small as what people think. It's like, oh, it's just constipation, no big deal. But these are things that we are all considering when we're thinking about how to manage and how to get patients to their goals. This is also sometimes signs of people having not having great diversities in their microbiome, which we'll talk about later. So this gives us an idea of patients' gut health when they're having particular symptoms. Next up, diarrhea. Diarrhea is another part of the colon that we start to think about. And so there's things like medications. There are infections, things like microscopic colitis, in which we can diagnose by taking biopsies of the colon when we do a colonoscopy. Also could be things like the things you're eating. So diets that are high in processed foods. They have a lot of emulsifiers and additives, artificial sugars or sweeteners that we see in diet sodas. Also, there can be things like after you have your gallbladder removed, you may notice you have a little bit more diarrhea. People with inflammatory bowel disease, sometimes an infection. So we do stool studies to figure that out. And so also we sort of try to figure out what the diet is like as well. Also can be a sign of microbiome changes. So after somebody's taken a long course of steroids or antibiotics, you may notice changes in your bowel movements at that point as well. We also have recommendations to help patients with that. So you don't have to live with all of this diarrhea for a long period of time. Because think about it, having a lot of diarrhea throughout the day, what's happening? You're losing water, you're losing a lot of nutrients, you may feel dehydrated, you may get dizzy, you're lightheaded, and that's just not what we want, okay? Next, staying in the colon, also we think about colon cancer and colon polyps. That's why it's so important to be screened for colon cancer, but a colonoscopy is the gold standard. The age of diagnosis of colon cancer has also been steadily decreasing over the past couple of years, so much so we've changed recommendations for it to be age 45. It used to be age 50. Now the screening age starts at 45, so we can collect some of those people and sort of prevent people from progressing to colon cancer. It's truly a preventable disease. And what is a polyp? When we are looking through the colon with a small scope, we're able to see little growths in the colon. And they start off really small, like these right here. We're able to remove those polyps endoscopically. So while we're looking through your colon with the colonoscopy, we take them out right at that time. By taking it out, we prevent them from getting bigger and growing into a cancer. Patients wake up often and say, "What do you mean you took out 5 polyps? I don't feel anything. I never felt anything before. What's the problem?" And that's it. It's something that is silent. It's something that you would not feel. You would not feel it until it was so big that it was blocking things moving through your colon. And that is when it's become cancer. And that's oftentimes when it's too late. The colonoscopies are not as bad as some people make them out to be. The day before, yes, you do not eat solid food the day before, but it's one day I tell patients in order to prevent cancer. And that reason for that is that you're taking a bowel preparation. You do have a lot of stools the day before. It's to get you completely cleared out. And that's so we can take a very good look when we go in with that little camera with a light and a scope. You are asleep, so you don't feel or remember anything. And we're able to look through that colon. It takes about 15 to 20 minutes. Patients wake up, and most of them will say, "Wow, when are you going to finally get started so we can get out of here?" And they are shocked when they realize we're already done. It's a preventative tool. It's super quick and easy, and it prevents people from having cancer. So if you haven't gotten screened, please get screened. And also remember to talk to your family members about your status as well. So patients who someone in their family has colon cancer, that means their family members are at greater risk for having colon cancer. So we may reduce that age in which they get screened. So For example, if my mother had been diagnosed with colon cancer at age 45, then my screening age would start at 35. So it's 10 years before that family member's diagnosis because they want to catch mine before it turns into cancer. And so making sure you have that conversation, it's not something to be embarrassed about. Have that conversation with your family because it saves lives. And it also helps your physician figure out when you need to start to have your screening, whether you're average risk and there's nobody in your family with colon cancer, so you start at 45, or if you should be sooner. Or if you have alarm symptoms like blood in your stool, that's a big deal. Don't just assume it's hemorrhoids because you don't know if no one's ever taken a look inside with the colonoscopy. So make sure you get screened and talk about it with your family. And so now let's pop over. Now that we talked about the entire GI tract and we talked about everything that can, some of the symptoms that you can have when you should go see a physician. Now let's talk about this big buzzword, which is gut health. What is gut health? You see it all over social media and in news magazines and on the television, and people sort of promoting what gut health is, right? And so what they're describing is a gut that is in harmony. It's saying a gut that has this function up and balance of both the bacteria and all the parts of the GI tract. So we have bacteria that live symbiotically in our GI tract. And so all these things working together, allowing you to digest food without pain or discomfort, having normal bowel movements every day, no heartburn symptoms. So you should have the absence of most of those things we talk about at your baseline. That lets us know you are in sort of balance with your gut health, right? Some of the consequences of things that sort of are out of balance with our gut health, and this slide is out of whack here, but one of the things that gut health is not is when we are thinking about, when you look online about gut health, what do you see? People selling you green drinks, prebiotics, postbiotics, they're selling you teas, they're selling you powders, and they're all under the sort of the thought that they are improving your gut health. But these things are not improving your gut health, right? And so how do we know these things aren't working, or what do we know about sort of the nitty gritty of gut health? And that's where that buzzword microbiome has came into place. And so this is sort of a little fancy picture here, but I'm going to break it down. So I just wanted you to see sort of what people are looking at with a stool sample, or even on like the top of your hand or your skin, because we all have this sort of body of fungi, of bacteria that all live together in order that, and it differs in different part of our body. So from your mouth to your skin to your urogenital tract to your gastrointestinal tract, there's all a sort of family and diversity of microbiome that live there. And one of the big things that changes that are foods that we eat. So a diet that had, depending on if you have a diet that's rich in animal fat, a diet that's rich in plants with protein, plant-based protein, high in fiber. And these things sort of dictate sort of your microbiome and thereby your overall gut health. Things like whether you smoke, whether you exercise, your sleep. These are all things that sort of influence that, right? They also can influence your weight and whether you have diseases that are related to obesity. Medications we take, all things that sort of can affect our microbiome. And so, which is why we sort of highlight a lot of these things. And so we think about it sort of as a whole and things that affect your microbiome. And it's a little bit different than what we sort of think about with just us, right? So it also is affected by, if you think about our food intake. So for patients that are consume meat, I talk to them about pesticides that are used. We talk about sort of farming of animals and how that affects the soil, because our plant food also comes from soil too, right? What's happening to climate, what's happening in sort of agriculture and sort of our air intake. So these are all things that can affect our microbiome. And sort of what led us into sort of trying to understand where these increased obesity rates were coming from. And then we started to notice all of the other environmental things that were happening on a global scale as well, and how that may have been affecting sort of these rates of diseases going up, rates of obesity coming up. A lot of things are associated with our soil, with our sort of farming practices as well. And so we're going to jump back to, again, influences of the microbiome. And then let's think about sort of like a little bit nerdy things about it and like how we can change the microbiome as well. So here we see that many factors that we just talked about: diet, geography, the stage of your life, the birthing process. So something as simple as whether your mother had you vaginally or by C-section, vaginal birth, the baby has to go through the vaginal canal and they pick up all of that microbiome from their mom. Versus C-section, those babies are given antibiotics at birth and they don't go through that same birthing process. Things like stress, exercise, your metabolic rate, all of these things really, really affect your microbiome and sort of the diversity of that microbiome. And we also know that that outcome also affects how often you get sick, how well you recover, how your body is able to utilize energy from food, and how efficiently it's able to do that. So we know that everybody has these bugs that sort of help us live. We know they help us with food digestion. We know that it can be sort of wrecked by our environment or what we eat or medications we take. Now the question is, what happens and sort of how do we build up that microbiome? And are there things in science that we can change, right? So can we change it? And so first, getting a little bit nerdy is we know that these things change throughout. And we've talked about that GI tract, right? So from your stomach, your small bowel to your colon. And we know from studies that what type of bacteria we have in particular parts changes as we go through this area, right? And so you may have some things that should be found in your colon, some things that are found in your small bowel, some things that are found in your stomach. And so getting nerdy here again as we talk about, ignore this picture, but we're really just talking about fiber. And so we've been talking about how little fiber patients get in their diet, and it's super important for your microbiome. And so that's all this image is showing, is that by fiber intake. And what is fiber? Fruits, vegetables, legumes, whole grains, those are sources of increased fiber. And those things help feed your gut microbiome and also feed your colon cells to create things called short chain fatty acids. And that also is sort of helpful, that it sort of crosses your blood-brain barrier as well. So helps through everything throughout your system. And why, when they say that the gut is the second brain, that is why. So you have influences from your gut that also can influence that as well. Other things people think about with trying to affect your microbiome are prebiotics, right? So what is a prebiotic? Prebiotics are sources of food that help with your gut's microbiome and your colon cells. Your body really can't digest these things, so they make their way through your small bowel into your colon, and that is where they really act. And they act like food for your colon, okay? So they're foods like apples or asparagus or garlic, green onions, green vegetables, whole grains. These are all things that are prebiotics that really make it to your colon. So patients may say, oh, my food isn't digesting. I saw, bits of green vegetables in my stool. And I'd say, well, that's a prebiotic. And why you may be seeing that is your colon got the nutrients from that, but it made it through your small bowel unscathed in a way so it could feed those cells in your colon. And now probiotics. So when I talk about probiotics, patients are always saying, well, I take a probiotic. And I think most people think all probiotics are created the same. They all mean the same thing. And the fact of the matter is they really don't. You've seen all of these things on the shelves. So I want you to think about what we just talked about with prebiotics and how those things make it through your small bowel and your pH changes that happen from your stomach to your colon. And think about the probiotics. The whole reason, the way for them to work would be in your small intestine. So they have to make it through that really low pH in your stomach to make it to its area where it would actually work, right? And so why the ones that, we have to think about what are in these. So we had that slide that talked about all of those different strains of bacteria. So we have to think about several things. We think about a probiotic, and if we think logically about how well it would work. A, how does this probiotic know what strain my body needs and what I'm lacking in? B, will that strain actually make it through the pH of my stomach to my small intestines and be able to make any change at all? And C, how do I know what I'm lacking in, right? So that's sort of the things to think about before you pick up a probiotic. And that's also, so these are some of the things that the breakdown of what is actually in these probiotics, because patients think they all are created equal. As you can see, none of these have the same makeup of bacterium or phyla of bacteria in these probiotics. So all these things are going to react very, very differently. And this is why the guidelines for the American Association of Gastroenterology looked at what are these things actually going to work? And what they found was that's why we make no recommendation for these probiotics, because we've seen in clinical trial, we looked at bloating, abdominal pain, the reason why people take these, constipation, diarrhea, there was no consistency. And why is there no consistency? Because there's no test to tell me that this patient is lacking lactobacillus acidophilus, right? Or one of these different strains. And so we don't know how it's going to work for each patient, which is why there's so much variation as to whether they work or not. So I always joke with my patients to think about it this way. Trying to take a probiotic while having a diet that's poor, or a diet of processed foods like Mountain Dew and Cheetos, I say, and you try to throw this on top to just make everything better and go away. I always tell patients, think about it this way. If you were planting a garden and you just put fertilizer on top of chips and Mountain Dew, what's going to grow there? Probably nothing. However, if you put a fertilizer on top of apple seeds, avocado, or something like that, you'll soon and someday you'll get a burst of those things. So you have to have a good foundation in order for you to see any help from this. And what already changes your microbiome? What you eat. So these things usually aren't very helpful in most patients. So rather than going to the store and popping these things, and most of them haven't been studied in trial either. The ones that have been studied in trial, you will notice are more expensive, like the VSL3 and the Culturelle. You'll notice these are ones that require refrigeration. And so just taking one that's over the counter that was like $5.99, probably not doing a thing. The ones that have been studied are far more expensive. Sometimes these things range about $100 for a month's supply. So pretty expensive when you can have, a meal that was made of some whole grains and some vegetables. So that's the spiel about probiotics. Now, taking that and fast forward to some other things that may be helpful in changing someone's underlying microbiome. So we also just recently talked about some other things that can happen in the colon, and one of those is diarrhea. And that's diarrhea that sometimes can happen from an infection. And one of those infections can be something called Clostridium difficile, or C. diff. Now, that is a bacterial infection that we typically will treat with an antibiotic that only makes it to the colon. But sometimes in some patients, and this can sort of recur and it's not completely treated. It can be an infection that is really sort of life altering, because it can be spread through your household. You have to wipe down your bathroom or everything you touch after with Clorox to sort of kill the spores. And patients could get really dehydrated, and it sort of affects your activity of daily living. It's really hard to go to work. It's sort of miserable. And with the recurrence of this, sometimes we know that people had a change in their microbiome. And so we did studies with things called a fecal transplant. I know that sounds disgusting. However, it is us getting stool from a donor that we test, of course, to make sure it's free of disease, and sort of injecting it into people's colons so that we can change that poor microbiome they have in order to reset the balance, in a sense, and reintroduce stool with that diversity of microbiome we talked about. And so that's something that we, do in the hospital, where if the patient has a really diseased colon, in this case, it was a patient with inflammatory bowel disease that kept getting these infections over and over again. We do a colonoscopy. We go in and we inject that stool into the end of their colon, called the terminal ileum, and patients feel so good the next day. They are no longer having 15, 20 bowel movements a day. They're no longer feeling so dehydrated because they're losing everything. And so then we started to think, if we can alter people's microbiome by giving them healthy stool, what happens if you give somebody unhealthy stool? Well, there was actually a lawsuit about that. It was a patient that got a fecal transplant, had been thin her whole life, and got a fecal transplant from someone that had excess weight or was diagnosed with obesity. And this patient actually, her C. diff was cured, but she started to gain weight and said, wait a minute, what's going on? And she actually won the lawsuit because she said, you must have gotten the stool from somewhere else. I've never had this issue before. And that is a lot of where some of the science is coming from, to figure out, what can we do? Is this something that we can utilize down the line? Is this something that we can research and study to figure out what this microbiome is doing, so that we can use it as a treatment modality for patients down the line that suffer with obesity or suffer with other illnesses of the GI tract? So that's one of the cool things that's coming down the pike. And as you see, a lot more detail than a prebiotic. So looking at things a little bit deeper there. And so, coming to this, now people will say, oh, when you eat, everything is super simple. So, from everything I've just told you so far, it is not that simple as you can see. Of all the things that happen that sort of can happen into your small bowel, happen throughout your GI tract, and happen in your gut microbiome, and a lot of things that can disrupt that. So, the big picture is we are not quite there on just popping a prebiotic or a probiotic. It's no magical thing that we can do to change your microbiome at this point. We can use fecal transplants, but really the biggest thing is dietary changes and lifestyle changes. And that's where we're going to talk about a little bit more. So, what can we do? And so, talking to this group of Seventh-day Adventists, you guys are sort of an easier group, right? Because these are things that are already sort of ingrained in your religion. And so, you think about sort of the body holistically and think about it as a whole. One big thing is sleep. Is sleep from 7 to 8 hours per day. And there are many studies that show us that when patients get too much sleep, or too little sleep, they have changes in their gut microbiome. They also have changes in their weight as well. So we see shift workers, people that work overnight or shorter hours, they have excess weight. We see associations with depression and mood changes, but also patients have more fatigue, they have higher cortisol levels, and they seem to have more metabolic diseases as well. So that's why it's super important to have an optimal amount of sleep per day. Um, Also, movement. So, getting in movement throughout the day. The American Cancer Society has said that at least having 150 minutes a week of just movement is good for reducing risk of cancer. The American Heart Association shows that that is good for overall health and reduce risk of heart disease. So, we know in general that a minimum amount of some form of active movement per day allows people to sort of have a healthier life. Also, de-stressing. We know stress is a major part of cortisol changes. Stress is a form thing that makes us emotionally eat sometimes. Stress may cause us to sleep inappropriately. Stress may cause us to have other outlets like alcohol that are also detrimental to our overall gut health and to our liver. And so finding ways to de-stress with family, with your loved ones. Having plenty of water. We also have studies that show us that this is also very important to your overall gut health, your microbiome. Also helps with reducing fatigue, helps with bowel movements, help with brain fog and clarity. Also things that we really, really need to sort of help in overall health. And then we think about sort of what can we eat, right? And how do we make that easy? So you've heard us talk a lot about things that sort of can disrupt your gut health. So you heard processed foods, you heard sugary sweetened beverages, diets that are super high in saturated fat, meaning a lot of meat heavy diet. These are all things that will reduce your overall gut health and your gut diversity, and also increase your risk for things like the fatty liver we talked about, colon cancer we talked about, esophageal cancer, all of those things we talked about that can, and obesity risk as well. But what can we do? Make sure we have an increased diversity of whole grains, fresh fruits, vegetables, whole grains in your diet, and making sure we understand what those portion sizes should look like as well. So when I talk to my patients about what a healthy plate looks like, trying to get 2 to 3 servings of fruit and vegetables per day can be pretty hard if you're not really, really intentional about it. Thinking about trying to get 20 to 25 grams of fiber per day, but most of our patients maybe get 5 to 10. These are things that, again, feed your gut health, but they also help with weight stability, improving things like diabetes, because we know that that helps with increased satiation. The nerdy part of what fiber does is it takes longer to digest from the GI tract, so it helps you feel full for a longer period of time, right? But it also helps with regulating blood glucose as well, and it's helping with your gut microbiome. So I tell patients to try to have half of your plate be fruits or vegetables, and then when you think of the other half of your plate, cut that into fourths. So 1/4 of your plate can be a protein-rich food. And I always explain to patients, it does not have to be meat. There are far more sources of protein. We have beans, we have legumes, we have grains that can form double duty, like quinoa that has protein and fiber. So trying tofu, trying to have things that are nice and protein rich, but only recognize it does not have to be as large of portions that we do have. and trying to my best to get people to reduce processed meats, whole red meats, all of those things. We try to get them to really, really, really reduce, if not avoid. Then the other fourth of your plate being a whole grain. And so thinking about things like farro, quinoa, thinking of spelt, thinking of barley, thinking of all of these things, or plant-based protein pastas, chickpea rice. These are all things that are really high in both protein and fiber. And then trying to avoid excessive medication. So we're in a world now in which, people want to pop something quick for every single thing, trying to avoid that, because remember, everything has a side effect, even things that people think are benign. So we see a lot of patients for GI bleeding with ulcers from things that are over the counter, like an NSAID. So people may have a joint pain, back pain, or something minor, and they take a bunch of ibuprofen over the counter. And what happens over time, they start having abdominal pain, and now they are starting to see black bowel movements. Now they're feeling more tired. They don't know what's happening. But at GI doctor, I hear that you have a stomach ulcer that's bleeding, and that we have to go in, do an endoscopy, clip and close that, and get you off of those medications. So that's a simple example of things that people don't think about that can cause some really, really significant GI tract changes. So just thinking about medication sort of thoughtfully before you just pop a medication. And then getting people to avoid, sort of like we talked about, processed foods, sodas, and juices. These are things that we don't need in our diet that are really affecting our microbiome. And as you've seen, we talked about in some of those other slides, with the advent of these things over the years has really sort of, you've seen with the rise in processed food, we also see the graph. If we put it on top of that, we see a rise in obesity, a rise in diabetes, a rise in high blood pressure. So these are things that we want to sort of start to backtrack and really start to be a little bit more thoughtful about. And so, where do I tell my patients to start? We talked about avoiding the processed meats, the red meats, processed foods. And instead of trying to think about what we're avoiding, I ask my patients to think about what we need to get per day. So, if you change that mindset just a little bit to think about, my goal is to have 3 servings of vegetables per day, and an entire serving, right? And my other goal is to have 3 servings of fruit a day. I'm also trying to have 2 to 3 servings of beans and legumes per day. When you are trying to do this, you will find at the end of the day, you are so full that you have no room to have anything else. So you don't have room for the cakes and the cookies and these other snacks and things that you enjoy, because now you're so satiated, because those are things that really keep you full for a long period of time. And you'll also find that you start to have bowel movements that are better. The bloating gets better. Patients are able to sleep better. So these are all things my patients say, wow, who knew? And of course, cutting back on fried foods, because we also want to prevent cardiovascular disease as well, and cerebrovascular disease. And so I give people some tips to think about. So when we're thinking about breakfast, I try to get people to think about whole grains, fiber, protein, thinking about being consistent about these things in your day, even if you're not super hungry. So things like, Ezekiel bread in the morning, or Dave's Killer bread, are things that have 5 to 6 grams of protein, about 6 or 7 grams of fiber, adding some almond butter, which also is going to give you about 8 grams of protein and some fiber, and then maybe some chia seeds, another 5 grams of protein. So even if you're not super hungry, there's something that's super simple and small that have gotten you a lot of protein and fiber, and maybe adding some berries with some antioxidants and a little bit more fiber, right? So things that are super simple, that are well thought out, that is better than you popping by Starbucks or something like that. And then we talk about sort of how you can make certain things at home, like an oatmeal, and how we compare these to things that we may typically do. And so I ask patients to start paying attention to these nutrition labels, right? So I think sometimes what gets us is marketing. So if you look at most of us, I know I'm from the South, and my parents and grandparents would use Quakers for everything, right? So something you just kind of get used to seeing. And people say, oh, it's so easy, it's instant, right? But I joke with my patients and say, I want you to pay attention to the ingredients here, with the sugar and the salt and these natural flavors. And then you have these emulsifiers. So pay attention to these ingredient lists and how long they are versus this one, organic whole grain oats. That's it, right? Look at the sodium. And so our patients that have high blood pressure, I tell them to be cognizant of what your intake is, because people don't think of their oatmeal as having sodium. Whereas here we have about 270 milligrams of sodium in your oatmeal versus 0 here, right? And so paying attention to food labels, paying attention to nutrition labels, and paying attention to marketing as well. Because I joke with my patients and say, listen, this is instant as well. You can put it in the microwave. It just doesn't advertise it that way, but still in the microwave, in your bowl and done. And you can add your own flavor. You can add your own maple syrup, your own cinnamon, your own apples on top. And you're getting more whole grains, more fiber, and you're getting it without all the processed stuff and without the sodium. So I tell patients to add some flaxseed, add some hemp seeds, add your cinnamon, put it with your plant-based milk, your oat milk, your soy milk, pop it in the microwave, and now that's your meal without the sodium, without the saturated fat, without the emulsifiers and additives. And it ends up being cheaper. You get this big bag, which seems more expensive because it's like $7 or $8, but you get about probably 20 servings in this. Whether in this bag, this box of Quaker Oats, that's probably a little bit cheaper. Maybe it's $4 or $5, but you only get 6 servings, right? You get 6 of those little packets in the box. So just consider that as well. And then when we're thinking about bread, a lot of patients will say, oh, I just can't eat bread. It's going to make me gain weight. Bread is bad for you. And I tell them, I want you to think about the ingredient label. And so a lot of my patients get this Nature's Honey wheat, right? Everybody loves it. But do you see, you don't even need to be able to read the ingredients, but look how long they are. And the first one is unbleached enriched flour, right? So that means flour they've taken and basically degerminated and made worse, right? Whereas we look at Ezekiel bread, and the first one is organic sprouted wheat and water. Isn't that beautiful? Water and actual wheat. And then you have lentils and barley and millet and barley, all of these things that have given you more protein and more fiber. So these are things that we want to try to go for, just switching to Ezekiel Dave's Killer, so you get the protein, the fiber, and the whole grain that you're getting as well. And also a lot of into micronutrients as well. And then we talk a little bit about, for some of my patients that aren't quite vegan, we'll talk about ways to get high protein in the morning and getting them off of some of those sugary yogurts that you may see and getting them to think of a Greek yogurt. So something that's going to have a lot of protein, so 23 grams, and not the saturated fat. And as you can see here, we're going to have those live cultures with those probiotics that are already there. But no emulsifiers and additives and artificial sugars or sweeteners. So I try to get people to do the plain. I know it takes some getting used to the taste and flavor, but adding your own berries on top. So you don't have to have those emulsifiers and additives that sometimes can affect my patients' GI tracts and make them have some of those other things that are undesirable, like bloating and diarrhea and all of those things with those artificial sugars and sweeteners. Another great way, sort of adding your chia seeds, adding your hemp seeds, adding your, high protein granola to have a little bit of crunch. And that way you've had, again, a well-rounded sort of breakfast or snack that's super high in protein and fiber that help you to feel satiated as well. And then we talked about other protein sources, right? So I always tell my patients, you don't have to, I know the world tells you that protein equals chicken and fish and steak, right? So it does not have to be that. And I am plant-based myself. So I live this life of making sure I'm getting enough protein every day. So things like chickpeas, lentils, peas, tempeh, black beans, hemp seeds we've talked about before, but also using plant-based pastas, which is in these brands, are a nice way to sort of get patients started because they taste like regular pasta, but they also have a lot of protein. Things like spelt lentils and brown rice, I think this one has like 22 grams of protein. Chickpea rice, which is this white rice, has 11 grams of protein and 6 grams of fiber. So really getting creative with sort of even double booking some of your meals, like having a pasta that has chickpeas or a pasta that has edamame. So double dipping, so you can get enough and you also really feel satiated. So these are ways that are cost effective, so they don't have to be expensive. And so I think a lot of people think it has to be expensive to be plant-based or vegan. It's because they're thinking of processed plant-based foods. It doesn't have to be processed. So thinking of those things. And when you're shopping, just thinking about getting plenty of fruits, plenty of vegetables, beans, legumes, and sort of trying to, and those are things that really, really work really well to sort of think about colors and trying to, when you're making your plates as well. But also they get the common idea of fresh versus canned, right? And one of the things I talk to people about is if you, live in a food desert or it's really difficult for you to get back and forth to the store and fresh things go bad, then get frozen. No, it's or either pay attention to your canned things so that you're making sure you get the low sodium version. But in frozen versus canned, you see a big difference in sodium levels. So 0 sodium when it's frozen, 350 when it's canned. So just trying to get the one that are low sodium or just getting the frozen ones. Same, it's no big deal. And sort of trying to, again, when you think of your plates, trying to have colors there. So here we have some lentils, what is that? Brussels sprouts, avocado, tomatoes, mushrooms. We have a cauliflower mix with bunches of peppers and tomatoes and garlic, okra here. So just trying to think outside of the box a little bit while making sure you've sort of considered your protein and your fiber intake. So the take home from all of this is sort of don't make things too difficult. Think about sort of how you feel throughout the day. Don't ignore things. Make some, small changes step by step. Think about what your goals are, what your symptoms may be. Remember to follow up with your physicians. Diversify sort of your fruits, your veggies, and your beans, but trying to get a goal of 3 servings of each per day. Trying to think about eating things that are from the ground, from the earth, and less processed things. Paying attention to your packaging of your foods and looking to get ingredients that we can, keeping it simple, things you can pronounce, or making sure that you're seeing mostly, not a lot of sugar, high fructose corn syrup, and those sorts of things. Getting plenty of water, trying to get your sleep, trying to de-stress and get some movement in, but also paying attention to your body. So I am going to shut this guy off now as the last slide and sort of see if there are any questions that showed up in the chat, anything that came up that I didn't get to that you guys were thinking about. But thank you for your time today. We can't hear you, Doc.
Sorry, thank you so much. This was amazing, amazing. Thank you so much. It was very plain and easy to follow. And I love the way you went through those food labels. That's one of the things that I definitely talk to my patients about, because many times people are confused as to what's in food. And they're
Yes.
not reading food labels. And you only look at the marketing on the outside of the package, but you don't turn it around and actually read the food label and read the ingredients. So I think that is so, so key. I spend a lot of time talking to my patients, helping them to understand how to read a food label. And that's how I shop. Even if it's plant-based, I read that food label and it's not right, I put that thing back on the shelf. So thank you so much for going through that. And so I do have several questions. And for anyone else who wants to put your questions in the chat, please go ahead and put your questions in the chat. One of the first questions is how many times a day should we have a bowel movement?
Good question. And and I'm sure all the guys here are getting annoyed with us docs for saying this, but it's different for everyone, right? So it can range to, some patients, it may be normal for some people to have a stool every other day, or maybe a normal for some patients to have a stool after every single meal up to 3 times a day. And so it really depends on how patients feel, if patients are completely emptying, if they have to strain when they're having stools, going back to that Bristol chart, what those stools look like. And so if somebody is once a day, but there are those little pebbles, then that's constipation, or, but it can be somebody that goes every other day, but it was a beautiful type 3. And I'm clearly a gastroenterologist. I know I just call stool beautiful. I know. But type 3, in which they are not straining at all. They feel like they completely emptied and they're not bloated. And that can be their normal. So everybody's a little bit different. It depends on if you're straining, if you feel like you're completely emptied, and sort of how the stool looks. And so it can really vary from every other day to up to 3 or 4 times a day. But it should not be loose running stools and should not be really hard, pebbly, look like rabbit sort of pellet poo either.
Wonderful, wonderful. And what about what someone asked about, what is a concern or what does it mean when you have bright red blood in the stool?
That is a big deal. And people write it off as, oh, it's just a hemorrhoid. However, it could be a hemorrhoid, but also it could be rectal cancer. It could be a colon polyp, a colon cancer that is in the right side of your colon. And we see symptoms different depending on where in your colon a polyp may be, or a cancer may be, or an ulcer may be. So if it's something that's on the right side of your colon that's closer to your anus, it may be bright red. But it's on the left side of your colon, it may be black by the time it comes out, or maroon or burgundy. And other reasons for bright red blood can be something called diverticulosis. And that's when we have these little pockets in the colon. And those pockets are when you can have thinning of the mucosa in your colon, and they can easily bleed. And that's usually painless. So people will say, whoa, I saw a lot of blood in the stool. I don't know what happened. It was completely painless. I felt fine. And that could be from diverticulosis. And these are all things that we have to pay attention to. It could be inflammatory bowel disease. We just don't know until somebody has looked. And I've seen far too many times where somebody has said, oh, I just assumed it was hemorrhoids, and it was not. And I'm like, how did you know? Did you see a gastroenterologist? Like, oh, no, I just thought it was hemorrhoids. So you can't ignore that.
Right. So get that checked.
Mm-hmm.
So you mentioned something that I really love, which is fiber. That's one of my most favorite topics because I talk about it a lot in the context of the microbiome and its impact on diabetes as well, because it has a huge impact on the prevention and management of diabetes. You talked about probiotics, which I thought was really good because I too don't recommend probiotics for my patients. I tell them eat the fiber, which are the
Eat it.
prebiotics that will help them to get more of those microorganisms, which are the probiotics. And then those microorganisms will ferment that fiber and they'll make those postbiotics, like those short chain fatty acids, which do some miraculous things in the body. So I thank you
Yes.
so much for talking about fiber because I think it's something that's really neglected and most
Mm-hmm.
people really don't understand the true benefits of fiber. And so with that, someone asked, are fiber supplements beneficial?
Good question. And I always answer that question twofold. If I am seeing someone that is going from a diet that I have some patients that do not eat vegetables, right, or do not drink water. So if I am starting from the basement floor and they are having loose stools every day, I will start with those patients, somebody who has IBS and they say, oh, I can't tolerate it. I have pain or I can't eat fiber. It makes my stomach hurt. And that may be very well true because their gut is not accustomed to that. They have a microbiome that is not seeing fiber. So yes, your colon has to actually do work when it's breaking down fiber versus something that is completely processed that's already been broken down for you. So I will start with supplements and some of those people who have loose stool. And I specifically use a psyllium husk rather than some of the other ones you see over the counter like a Benefiber or Metafusil, because if you, again, looking at that ingredient label, you see a bunch of artificial sugars and flavors and emulsifiers that also contribute to my patients having bloating and abdominal discomfort. So they still won't want to use that either. So I will typically use that in the beginning while I am getting them to slowly introduce fiber into their diet little by little, so that their gut sort of microbiome starts to change. It starts to recognize these other foods. And so that can sort of change how they feel about those foods because now they can tolerate them, they can break them down, and they don't have discomfort. And now we're slowly being able to get them off of the sort of supplements and getting to actually just eat the fiber, which is what we really want to get to.
Wonderful. And along that, so you mentioned the word processed foods.
Mhm.
And I know that some people might understand what that means and others might not. So, might you give us some examples of what you would consider those processed foods that we really should be trying to avoid on a regular basis?
That's a good question. And so I'll start with the one that, most patients kick me about, and that's processed meats. And so let's go back. What processed means are things that are taken from their natural source and created into something that can be more shelf stable, that it's cheaper and that lasts longer, that is more palatable, meaning that is easier to break for your body to break down. It's usually softer in texture. It usually looks prettier. It's a beautiful color. And so, in problem is that has become sort of it's in everything. And so once I break down food labels and what some of these sneaky words are that they put in the back of things that we don't know what they mean, so we ignore them, like polysorbate 80 or carboxymethylcellulose, others seen as CMC. Ones they've gotten a little bit, most consumers have seen more like carrageenan and lecithins. These are all things that are emulsifiers. And what we've seen over time in studies is these things affect your microbiome, and your body is like, what is this thing? I don't know what to do with it. And that's why people start to get more inflammation and more sort of excess weight in the mix section here, because your guts are like, I don't know what to do with this. And that's why I don't like it. And so processed foods you may notice are things like chips, or cookies or probably like deli meats or some of these sort of frozen sort of meals, or even some of these healthy versions that are like processed fake impossible burgers and things like this. These are all things that have been processed so that you can easily eat them. And so the example I give my patients are, if you sit down to watch a television show and you take out a bag of Oreos, you can, or a bag of chips, you can easily eat sort of an entire sleeve of Oreos or an entire bag of chips before you know it in that, 20-minute show that you're watching. And that's because it's super palatable. It's so easy to swallow. You don't have to work a whole lot to chew it and swallow it down. It's super easy. And there's studies that have shown that people are able to eat greater volumes of food that are processed because of this, right? And the other part of that is, but if you compare that to an apple that you have cut up, right, that is not processed, it takes you so much longer to chew a slice of an apple than it does a potato chip. So you're going to be able to eat that apple slower, and you're going to feel far more full because it's not processed, because you have the fiber, because you have the protein. And so that is sort of the difference, and sort of why we're able to eat so much. And then also it's sort of a simple carb too. So it's gone very quickly. So you can eat an entire bag of chips and you will be hungry again in 30 minutes. Where if I tell patients, how many apples do you think you can eat in a row? And the answer is that going to be not very many, because of the GI physiology that's happening, which is that it takes far longer for fiber to be processed through the stomach. It's like people stay full for a lot longer. So you're satiated for a longer period of time. So I tell patients, yeah, you try it. Try to cut up 4 apples and sit up there and see if you can eat it. And the answer is probably not, unless you really stuff yourself.
Right. So it goes, another food that I tell people to avoid is cheese, because cheese is also really highly processed, in addition to lunch meat and all the things that you
Lunch meat.
named. And yeah, so those,
They don't like us
if
for that, huh?
no, they don't. But I know those are convenience foods, but
Mhm.
I tell people the key is really, you want to eat foods in their most natural state as
Exactly.
much as possible, or foods that are minimally processed. Because
Yes.
otherwise, like you say, you're going to be getting a lot of things that are going to be harmful to the gut. And it goes back to that really reading those food labels and understanding what's in the foods that you're eating. You mentioned earlier about legumes. So, can you again define what legumes are?
Legumes are a tricky one for a lot of people. So they're sort of in that category, sort of between sort of beans and sort of grains. And so a good example of that would be like lentils, for example. And so trying to get people, and I just think of like, if you go down the aisle, if you're from the South and you have a grandmother that, pop beans and peas and that kind of thing, everything on that aisle that comes in those bags, those are things you want to try to be getting in to eat when you're thinking. And these are things that, sometimes that's why I put that bag up to show. I actually show my patients what I'm trying to get them to eat in certain labels, because most people are like, barley, are you crazy? Spelt, what are you talking about? What are these things? And so trying to get them sort of trying to get their microbiome ready for them by like telling them about Ezekiel bread or Dave's killer bread, so they can kind of see, oh, this isn't so bad, or adding it in their brown rice or adding it with their quinoa. So they sort of are with your lentils, so that I'm sneakily sort of increasing that microdiversity so that you start to crave some of these things a little bit more. So legumes are sort of the one that people are like, what are you talking about? So it can be a tricky one. That's sort of a mix of two things that we commonly think of.
Right. And I really think of legumes like beans, peas, and lentils. But it's interesting when you mentioned barley. I actually been eating barley grits. Now I mix it
Ooh,
in with my corn grits, and I mix them together. So I mix barley and corn grits
I love
together.
that.
And then it's actually pretty good. And then I put a little avocado in there instead of butter, and
Mm.
it gives that avocado
Cream.
gives it that buttery flavor. And I learned that when I was in Louisiana, by the way. But the barley grits are actually pretty good. So
Nice.
so different, things that you never really thought about.
Exactly.
So someone asked, how do you treat slow transit constipation?
Ooh. Good one, good one, good one, good one. And so this is an instance in which some loading you with fiber may make you cough a lot of bloating, right? And so in these patients, some of the things we try are really getting a lot of movement in. So in lower extremity exercises, so yoga exercises, squatting, getting cycling. These are all things that we're trying to motivate and move the GI tract. Getting plenty of water, plenty of water, and also frequent meals throughout the day, because when you eat, what is happening in your colon or in your rectum, it sends signals called MMCs. Fancy sort of title, but really is giving a signal to your colon that, oh, I need to eliminate to allow something else to come in. So you want to make sure you're constantly having these signals, because people with slower transits tend to have less of those signals. So you want to get those signals going. And I have a lot of women in particular that typically have slow transit colons. Fun fact, women have longer colons than men, but also and so also when people have had like surgeries, women who have had hysterectomies, they've had C-sections, they have all these things that cause adhesions as well. So while a lot of women may have a slower transit colon. So A, getting you moving, B, having sort of increasing those MMCs, those contractions by eating those smaller frequent meals, which is really, really hard for a lot of my women because they skip meals a lot during the day as well, because they're running around with kids or helping somebody else or working. And so women tend to skip far more than anyone else. So getting your water, not skipping meals, getting those small frequent meals. And then in some women, we have to add like a Miralax or something. And so we can keep things moving. And we use that to sort of bring water into the colon. I like that one over a lot of the other laxatives or things like that, because this one doesn't alter your electrolytes, doesn't alter your microbiome, and it's sort of not something you get tolerant to, like a stool softener. Because stool softeners over time, you'll notice people start at 2, now they're at 4. Now it keeps them. Now they just eat more and more and more. So, and they're also not something like a stimulant that causes people to have to rush to go to a bathroom. So my goal is just to bring water into the colon so that keeps you going.
Good, good. So, and one of the other things that I do is Pilates, which
That's a
is
good one.
nice. That helps as well. Another question is, in what ways does stress affect the microbiome?
Good one. Very good one. There are tons of studies that show that it has a major impact on the microbiome and a major impact on the higher frequency of patients that have IBS or irritable bowel syndrome. And so we see that when people have those constant insults, they have higher levels of cortisol, which also affect your microbiome as well. And so these are things that we know have really, really high impacts in reducing that diversity. So I tell people to think about stressors. It's the same thing as your body doesn't really care if the stress is from a car accident or the stress is from you worrying about speaking in public. They all cause those changes. And so trying to find things to sort of reduce that overall sort of worry and stress, which is sometimes easier said than done, which is why sort of meditative sort of practices are really, really helpful. Mantras, having a routine, having that support, having your faith. These are all things that are really, really helpful to be consistent about, so we can sort of reduce that underlying stress, so people aren't sort of up and down all the time. And so it may happen every once in a while because life happens, but trying your best to sort of have that mindfulness to be able to stay stable most of the time so that you don't have those consistent symptoms. Things like diaphragmatic breathing are also really, really helpful, as well. And some of the things, because of the vagus nerve and how it's attached to your colon, and also been shown to sort of change your serotonin levels and things that also affect your second brain or your gut as well.
Right. So then it goes back to those other lifestyle factors too, like make sure you're getting enough sleep and
Hmm.
that exercise, getting enough sunlight
Yeah.
and also, practicing your faith, which is really important, especially for me. That's always a stress reliever and exercise. We
Yes.
think that, it takes a little bit to get yourself going when you're trying to exercise, but once you get into it, you understand that exercise is really important for in terms of managing stress. So, just a few more questions here, and I know we're going to wrap up. But can you talk a little bit? One of the things that I see a lot in my practice is GERD or reflux. And people are always coming in with GERD and reflux, taking over the counter medicines, taking PPIs. What would you suggest as ways to, one, prevent GERD, and other ways that we can treat GERD with lifestyle factors?
Yeah. So that's a really, really common one. One of them is I tell patients to start with a food journal to see when you are noticing that you have symptoms, because just because people were able to eat something consistently a long time ago, they think they should be able to continue to eat that. But I tell people that maybe your body sort of signals to you that now we need to stop, right? So when I was in med school, yes, I could eat pizza at, late at night while I was studying. But now if I do that, yes, I am going to feel it, right? So now I no longer do that anymore. But first starting with a food journal and then recognizing some of those common trigger foods like tomato-based things, citrusy foods, spicy, even peppermint. Red wine, chocolate. It's a large array of things that are triggers. So I tell patients you don't have to cut out all of those things, but some of them may be triggers for you. And that's what we have to sort of try to delineate. Also, patients that eat large meals, and I tell patients, show them like a picture of the anatomy and what is happening when you're eating this really large meal. So that's another thing to sort of reduce is sort of the size of the meals you're eating. Slowing down when you eat as well, because otherwise you're also ingesting air, and that also sort of blows up the stomach. Not eating and then laying down. You need to be up at least 90 minutes after you have a meal prior to laying down. Again, that's anatomic, right? And I tell patients, other the big thing that you can do is to raise the head of the bed, not just with pillows because you'll fall off of those, but the bottoms of the back of your bed with bed lifts. That's to help with physiology. Other things we can do are plenty of water for sure, always that. But also, what was I about to? Oh, and weight loss. So if you have increased abdominal girth, it's also pushing up on the diaphragm and pushing the stomach through that little small break we all of us have. So now your stomach is in your chest and you have a higher incidence of sort of reflux. So having that abdomen be nice and pushed down in its place, not having these really large meals, watching what you're eating, and then not eating and laying flat.
Oh yeah, that's good. I tell my patients 3 or 4 hours before laying down. So maybe they're probably like, wow, that's a long time. But
Look,
sometimes my patients are eating very large meals
they
in
need
the
longer.
evening and then lying down, which is definitely going to cause more reflux, cause
Mhm.
other problems as well, like diabetes and
Bloating
other
and
issues.
oh yeah.
Yes. So definitely important. So can intermittent fasting help repair our guts?
Ooh, another tough question because it's like everything in GI, it depends because there are pro and con studies for both. And so when I talk to patients about and who it works for. And if you are a person that when you intermittent fast, you are hangry and you are miserable during that time, and you are counting down at a clock to when you're going to be able to eat, and then when you eat, you overeat because you were so hungry, intermittent fasting is not for you because now it was no purpose in what you were eating. And now because you're so hungry, you're not making the best decisions. So you're probably not being so, your first meal is probably not, some type of Dave's Killer Bread with almond butter and chia seeds and fruit. Your first meal is probably something massive and gluttonous, right? Which is probably not helping your microbiome and not helping for weight gain because now you're consuming a larger caloric intake and sort of eating so rapidly, you're not listening to that signal of satiation. So probably not helpful to your gut microbiome, or your weight, but which is also again not helpful to microbiome. But if you are someone that works really well for you and you're still able to get an appropriate amount of calories and protein and fiber, and you're not super hungry when you are having that first meal, that may work okay for you. That may be something that if you're able to sort of still create those well-rounded meals with plenty of fruits, plenty of vegetables, and you're not starving, then that may be something that may work well for you. So I always tell patients, really, you should talk to your physician or your dietitian to really decide what is best for you and not just sort of pick things because we see it sort of, oh, this is the must do is for everybody, because there's no one size fits all. There's no perfect thing for everyone. That's just not true.
Right. I think that is important is understanding what's going to be best for you. And but we know that many of the things that you shared today are best for all of us, which is good. Getting in more of those fruits, those
Oh yeah.
vegetables, those whole grains, those legumes. That's really, really important for helping our guts. And I know someone asked this last question, and I'm going to answer it. And if you want to chime in, you can chime in as well because it's a little bit veering from what we're kind of talking about today. But the question is, do you have any recommendation for diabetes aggravated nerve pain damage? And what I would say
Mm,
as a family doc is It really all depends, but mainly it's about managing your diabetes. And so cutting out that saturated fat. I know we talked about that earlier in terms of the gut. Saturated fat is it can cause you to have insulin resistance and not have good control of your diabetes, which can also lead to more of that nerve damage. So cutting out those saturated fats, eating more fiber, is always good to help control diabetes, and it can help in terms of managing your diabetes. And it's likely the diabetes and that insulin resistance, that excessive fatty acids, which are contributing to that damage to the nerves and the blood vessels. So it's one of these days we'll do a session on diabetes, because I love talking
Yeah,
about diabetes. But for today, I'll leave you with that part. And I don't know if Dr. Laster, you wanted to add anything
I think that
to
was
that, or
perfect.
if there's or if there's anything else that you want to leave with our audience today. This was such a great presentation. I know that this has added a lot of benefit to all of our hearers today. So is there any other advice or suggestions that you want to leave with the audience today?
I just want our patients to find a physician that you can talk to. Don't be afraid. Don't feel like something is too silly. Advocate for yourself and pay attention to your bodies. You know your body. And so don't just think something is, no big deal. I want patients to be seen, get your yearly checkups, make sure it's a physician that you are comfortable with. So speak up for yourselves and get seen, get screened.
Right. And you know what, when you said that, and I added one more question before we go here. I know you talked about colonoscopies
Mhm,
earlier, but I know in my clinic, because sometimes they're not always available. What do
mhm,
you say if like someone says, well, my doctor gives me a fit test? What
mhm.
would you say about a fit test in comparison to a colonoscopy? In case anyone listening has been doing those tests in lieu of the
Colonoscopy.
colonoscopy.
Good question. So, if if it is someone that is completely against having colonoscopy and they are average risk, meaning there is nobody in their family with a history of colon cancer, and they themselves are not having alarm symptoms like blood in the stool or inflammatory bowel disease, then that is something's better than nothing, right? So I will say, great, get the fit test. But I always tell people, if this is positive, that still means you have to have a colonoscopy, right? So that's why colonoscopy is the gold standard, because sometimes those tests can have a false negative, which means that the test says that it's negative, but there actually is a polyp that needs to be taken out. And so they're not perfect. Whereas with the colonoscopy, we can actually see the colon taken out at that time. But if there's all that you can get, that's all that's available, that is at least a start to your screening. I want people to get screened no matter what. So at least start there with a Cologuard or fit test or whatever your physician's office provides. But you have to be a candidate. So people who are not candidates, and I see these tests used inappropriately, and are people who have had a history of polyps, you are higher risk. You need a colonoscopy because you are at risk for having them again. If you have a family history of colon cancer, you're not eligible for those tests. That means you have a higher risk. If you have blood in the stool, if you have inflammatory bowel disease, these are people that should not have these screening tests done because they are not eligible. They are by definition high risk patients and should go to colonoscopy. But if you're an average risk person, you know your family's history, you don't have any other symptoms, and you refuse to do a colonoscopy, no big deal. Just start with something, recognizing that if positive, you need a colonoscopy because we have to be able to take those polyps out. The test is not curative, it's just to give us an understanding of your risk.
All right. One more question. I know I keep saying that, but I know one of these things that came through, and in the last few years, we saw the death of Chadwick Boseman, who was a young person who died from colon cancer. And I think that was one of the reasons why we started seeing that now we have screenings for colon cancer starting at 45, as you mentioned earlier, versus 50. Can you tell us just a few simple things? And I know you've mentioned everything that you said today, but specifically really honing in again about ways that we can protect our colon and prevent colon cancer.
Yeah. So the World Health Organization has listed out several things that are carcinogens, meaning things that we know can increase one's risk for colon cancer. And so many people think about smoking, and we know smoking, lung cancer. We know alcohol, liver disease, but people will ignore some of the things that we know are sort of risk factors for colon cancer. One of them being red meats. World Health Organization has long since told us that red meats increase your risk. Processed meats. So I know that our, people love them, but the bacons, the sausage, the deli meats, all of these things are processed meats. These are things that increase your risk for colon cancer. Having excess weight or obesity increase your risk for colon cancer. Smoking, and alcohol both increase your risk for colon cancer. Having a sedentary lifestyle with a lot of saturated fats also increase your risk for colon cancer. So all the things that are not helpful for your gut, that are not helpful for diabetes, your heart, your weight, are all things that are also not helpful for your colon and your risk of colon cancer. So, and that's why I tell patients kind of this getting into a healthier lifestyle and a healthier diet is kind of nice for everything because it helps my patients reverse their diabetes, they reverse their blood pressure, they reverse their high cholesterol, they're not having joint pains anymore, they are not having brain fog, they're pooping every day now, they're not bloating with abdominal pain, and they're not having this increased risk for colon cancer or cancer risk altogether. So it's really helpful for everything. Their fatty liver has reversed. So recognizing that it's sort of something that is helping every single ailment and every single disease.
Right. I see that we've seen here that having a healthy gut, as you said, can help us to prevent almost every disease that you can think about: diabetes, cardiovascular disease, all the things that are involved with our gut and our intestines and our colon. And having a healthy gut also helps us to have a good mood and can prevent things like anxiety and depression. So everything is really centered in that organ, our gut. So it's important for us to think about the health of our gut. That's our stomach, our small intestine, all those things you named today are important for us to think about that health and how it impacts us overall. So thank you so very much. We've gotten some very good comments that this was a very good presentation. Thank you for the valuable information. So people really enjoyed this presentation. So thank you, Dr. Laster, for being with us today and for all of this wonderful information you have given to us. And thank you all of you who have joined us today. We hope that you will take this information and please share this link with someone who didn't watch it today. Share it, tell them the valuable information that you received by watching this and how people can start to live healthier lives by helping them to have better gut health. So thank you again for joining us, and we'll see you next time. Take care, everyone. Have a good day. Bye.